Health Canada has approved the Pfizer-BioNTech COVID-19 vaccine for kids 5 to 11 years old. It's the first vaccine for that age group approved in this country. 2.9 million doses, enough for a first shot for every child in that age range in Canada, are expected to start arriving in this country on Sunday. Now, more than 1 million children in Ontario aged 5 to 11 will be eligible to receive the COVID-19 vaccine starting next week. And Dr. Isaac Bogoch, as promised, infectious disease specialist at Toronto General Hospital, is back here with us to answer your questions about the COVID-19 vaccine for kids. So, Dr. Bogoch, welcome back. And we'll dig right into this first question here from Sinead. And here's what she wants to know. With the survival rate of COVID-19 being so high, why would I risk any side effects from the vaccine for my children?
Yeah, so Sinead's got a good point. She's completely correct in that the survival rate for kids, especially the 5 to 11-year-old cohort with COVID-19, is extraordinarily high. I think the other point, though, is that there's more to this than just mortality rates. There's also what we would call morbidity, right? You don't want kids to get this infection because they can be left with long-term complications and persistent symptoms afterwards. And, even though a small percentage of kids can get sick, there's still some kids that really do get sick. So it does happen. Kids can get sick and land in hospital. It's just less likely to happen compared to adults. So there still are some very good reasons for kids to get the vaccine. The other thing to consider is, who are these kids around? Kids can pick this up at school or in extracurricular activities and bring it home, and also can infect vulnerable close contacts. I mean, you should also think about how this child will interact throughout the day. If you vaccinate your child and prevent them from getting COVID-19, will this have less disruption on their day-to-day activity? For example, absences from schools if there's an outbreak, for example. So lots of good reasons to vaccinate children.
Okay, and this next question here, really interesting, from Jeffrey H. And he's wondering, what do parents do if they have an 11-year-old who turns 12 in January? Wait for the adult vaccine or get the child dose as soon as possible?
Right, there's lots of correct approaches, and the right answer here is to sit down with whoever's looking after your family and your child and discuss this with your healthcare provider. But there's lots of right answers here, and NACI even outlined several of them. One answer would be to get the pediatric dose of the vaccine. That's the 10 microgram dose of the vaccine when the child is 11, and when the child turns 12, they can get the 30 microgram dose, or they can get the pediatric dose, the 10 microgram dose, and also get a second smaller dose, the pediatric dose, shortly after they turn 12. There's a lot of right approaches here. Every child is different, and your healthcare provider will really understand the nuances associated with your children and these vaccines and let you know what the best approach forward is for your child.
Okay, now this next question from James might require a little bit of explaining on your part as well. James wants to know, will my child be monitored and tested to ensure that all of the spike proteins leave their system as per the expected timeline?
Yeah, so short answer, no. Longer answer, when you get a vaccine, your body produces an element of this virus, not the virus itself, but a small component of the virus, and then your body mounts an immune response to that. And the part of the virus that you start to produce is a part called the spike protein. So your body recognizes that, your immune system mounts a response against that. So if you're actually exposed to the real virus, your immune system says, hey, I've seen this before. And if they attack it, so you don't get, you ultimately don't get infected with COVID-19, or if you are infected with COVID-19, you have a much more mild illness. But there is no way to, for example, monitor, the levels of spike protein produced by, like vaccine-related, interactions. Like, we just don't do that. I think you could in non-conventional, non-clinical settings. I'm sure there's ways to do this, but this isn't done en masse.
Okay. Next question here comes from Tom B. And he asks, what percentage of 5 to 11-year-olds get any symptoms worthy of medical attention of any sort from the virus?
Right. So I think it's another way of looking at this is, let's look at all Canadians with COVID-19. And when we think about the 5 to 11-year-old crowd, 7.5% of cases are in the 5 to 11-year-old crowd. The 5 to 11-year-old crowd represents 0.3% of hospitalizations, 0.3% of ICU admissions, and 0.007% of deaths. So yes, of course, it's less likely for this cohort to have severe outcomes, but it does happen. I mean, it still happens that people in the 5 to 11-year-old cohort get sick enough to seek medical care. They get sick enough to land in hospital. It's just less likely compared to adults. But it does happen, and the vaccine will certainly prevent that from happening. It'll also prevent kids and lower the risk of kids getting the infection in the first place. So even if they're not sick enough to seek medical care, you also prevent the whole other myriad of potentially long-standing complications that this virus is known to cause.
All right, so now you listed off there sort of the percentages of those who have, medical-worthy symptoms, but this question here from Jane is wondering how many 5 to 11-year-olds have actually died of COVID-19 in Canada.
Now, it's awful to think about 5 to 11-year-olds dying. I believe the number is 2, but I'm not 100% sure. I think it's 2. I know it's less than 5. And of course, every death is tragic. But yet again, there's more to vaccination than reducing mortality in this particular cohort. You also want to reduce morbidity. And then you also want to think about the safety of those close contacts to the child who's getting vaccinated. So there's, again, lots of reasons to consider vaccination in this cohort.
Okay, let's go to this next question here from Carol Ann. And she asks that she read children's vaccine doses will be spaced out for 8 weeks. You mentioned and clarified at least 8 weeks. So her question is the percentage of protection from one dose known?
Yeah, Carol Ann's got a great point here. I can't quantify the degree of protection after a single dose, but it's not nothing, right? The people will certainly have some benefit after a single dose of these vaccines. Kids mount a pretty impressive immune response to them. We saw that in the clinical trial. So there probably is some degree of protection. Of course, you got to have 2 doses, but yeah, I think a single dose will certainly offer something during that time window between dose 1 and dose 2, which, based on NACI's guidance today, should be at least 8 weeks apart.
Okay, and as you said, it does offer some protection, even though we might not know the exacts here. So Aaron M. is wondering, will children be able to isolate for a shorter period of time if they have had 1 dose? We know it's a patchwork sort of across the country, but for example, in Ontario, if you're unvaccinated, you travel outside, you kind of have to isolate if you're, under the age of 12 for 2 weeks.
Right, yeah, Aaron's question is tough. I don't know. And as you point out, it is a patchwork across the country, so there's going to be different policies in different places. My gut says no. I bet that it's going to be, if there is a policy about isolation and vaccination is integrated into those policies, my guess is that it'll be either 2 doses or you're not considered fully vaccinated. That's my guess, and I think we'll have to see what the various provinces do as we move forward.
Okay, you said various provinces, and that kind of rolls into our next question too, because Barrett wants to know how will they handle 4-year-olds who are turning 5? We certainly saw different rules when it came to different provinces with the 11 and 12-year-old age group.
Right. My guess here across the board is that you've got to be 5. You're not going to get a vaccine if you're, 4.999 years old. I think the provinces are going to be sticklers for the 5-year-old cutoff. Again, we'll have to see what they do, but that'd be my best guess. If you're not 5, you're probably not getting this vaccine.